Hello, I'm Dr. Rachel Hall of Evolve Dental Healing. We're a holistic dental practice based in Kenmore in Brisbane, and I wanted to talk to you today about how tooth decay isn't just about how much sugar you eat, that there are other things that you can do other than brushing and flossing and avoiding sugar that can actually help you to prevent tooth decay. Now, brushing and flossing are essential. You've got to remove the food and the plaque buildup from off your teeth. And you also need to reduce your amount of sugar, because by eating sugar, you're going to be feeding the harmful bacteria that will breed and grow and cause tooth decay. And that sugar is also going to be causing harm through the rest of your body. So I want to thank you if you're here joining me live, and if you're watching the replay, then thank you for taking the time. I think that's fantastic that you're educating yourself about your dental care and how you can live a better, healthier life so that we can help you to fill your years and not your teeth. So look, one of the greatest fears for most people is a trip to the dentist. You know, especially when you know there's work to be done. You know, all that noise, the smells, the taste, the sensation, the needles. Yes, I know they're a necessary evil. It doesn't really drum up that warm, cozy feeling. But you know you need to get it done, because once your teeth deteriorate, they're going to be damaged to a point where they need to be restored. And if you leave them too long, they're going to get painful. You're going to end up with a dental emergency. An emergency that's going to cost you pain, time, and more money, and more invasive dentistry, or even worse, it could cost you your tooth. Now, my job as a dentist is twofold. It's to undo the damage or correct the damage by removing the diseased tooth and then restoring the tooth with a filling material, and helping you to understand why that happened and how to stop it from happening again. So, just like doctors, you know, we have a role to play, but it's not for you to hand over your dental health to us as the professionals. It's your job. You live with your teeth 24/7. You're the one caring for them and looking after them. So if we can empower you and help you to understand what changes you can make to keep your mouth healthy, then that's my other job. So dentistry still thinks that putting mercury fillings in your mouth is safe, that using fluoride is fantastic, and that we can't stop you from getting cavities other than telling you to brush, floss, and don't eat sugar. Now, what if you are one of these people who brushes really well, you floss diligently, you have a low sugar diet, and yet you still get cavities? What is that about? What is going on that's setting you up for tooth decay? Well, we can say, oh, it's my genetics, I got bad teeth, my mum and dad had lots of problems, I've got poor health, and yes, that is a contributing factor. But dentists aren't really trained to look at the why, other than you're not brushing properly. So holistically, we want to know what's going on in the body that's led to the point where you can decay the hardest material that your body can produce. So we're going to ask questions about your lifestyle, stress, diet, nutrition, and sleep patterns and so forth, because these do impact on your risk for tooth decay. So if you can believe that you can be responsible for prevention, and you can do this naturally and easily, then we should teach you what to do that. So what causes tooth decay? Well, the conventional model is you eat sugars. That feeds a type of bacteria called strep mutans that's responsible for causing tooth decay. That bacteria eats the sugar, produces acid. That acid dissolves your tooth enamel, the bacteria invade your tooth, and now use the tooth as its source of food. And that eats away at the tooth structure. However, that can only happen when the conditions are right. So if you've got good, healthy bacteria and you're feeding them the right diet, then those bad bacteria can't take over and start attacking your teeth. So what we've looked at holistically is that there are some factors that go on with your diet that contribute. So one of these is not getting enough minerals. Not getting enough fat-soluble vitamins is another. And those vitamins are vitamin A, D, E, and K, and if you're English then they're vitamins, and I am English and it's took me a long time to start saying vitamins because the Australians don't understand me when I don't use that word. So, and the other thing is those nutrients not being available. So you might be taking them in, but if your gut, if your digestion isn't working properly, you can't absorb them. And one of the things that inhibits that is having a diet that's high in phytic acid, and that comes from eating lots of pulses and beans and legumes, and so that has an influence. I think also cereal and grains, yes, cereal and grains also produce phytic acid. So if we can switch the balance of the diet to help you get more minerals in, get those fat-soluble vitamins A, D, E and K, and also make them available so that your body can take them in and get them from your gut into the tissues, so into your bones, into your teeth and your bloodstream where they need to go, that's not only going to help you be healthy, but it's also going to help prevent tooth decay. So over time, if your diet lacks vitamins and minerals from having a poor diet, or you've got high phytates, as I said, from grains, seeds, nuts and legumes, then the blood chemistry changes. And there's a really tight ratio of our minerals to each other for the body to be healthy. So there's a shift between the amount of calcium and phosphorus. And when that comes out of balance, that's going to result in minerals being pulled from your bones, which will cause tooth and bone loss, what we call tooth decay and osteoporosis. So once your digestion starts to become a little bit hampered, your ability to absorb your nutrients becomes even more problematic, and it sort of self-perpetuates, and you become in this vicious cycle, the catch-22, where your diet's poor, the nutrients aren't being absorbed, then that's going to mean that you become sick in the body, and it's harder and harder for your body's biochemistry to manage. Then if you add to that our daily habits like drinking soft drinks and sodas, coffee, then mineral depletion is going to continue and you become acidic. So your body has to buffer that acidity by pulling the minerals from other areas of your body like your bones and your teeth. So that's going to make them more porous. It's going to make them more prone to tooth decay. So there's a whole issue then going on with the types of unfriendly bacteria and microbes, and they're going to make their way into the oral cavity through your poor food choices and any dental work that is failing. So if we can clean up your mouth and clean you up with better food choices and get you going along maybe to a holistic dentist, then we've got some steps in place that are going to prevent you from having to be over and over in the dentist chair getting work done. Hopefully we're just then examining and doing maintenance to keep everything healthy. So there are some important details in taking care of your oral health. So first of all, if you're going to take a holistic approach, you need to consider more than just flossing and brushing. You've got to focus on everything. You know, if you're just looking at brushing and flossing, then you're being very short-sighted, you've got your blinkers on and you're not seeing the bigger picture. It's not going to give you the best oral health possible. So traditional dentistry and traditional oral health care is encouraging you to use toothpastes that are loaded with toxic ingredients like fluoride, sodium lauryl sulfate, which is the stuff that makes it foamy, triclosan and sorbitol and things like that, which are actually proven to be very harmful for the body. So what you put in your mouth, not just the toothpaste and the toothbrush, is going to determine the health of your teeth and gums. So if you're having too much sugar, too much processed foods, that is going to make the problem worse. If you're having a diet that's rich in vitamins and minerals and you're getting supplements that are easy to digest, then you're going to get a strong antibacterial component. And that's going to keep those nasty, harmful bugs and microbes and bacteria in your mouth at bay. So when you focus on tooth health, you've got to make sure you eat plenty of foods that are rich in the vitamins A, D, E and K that I've mentioned. And those are going to include things like beef liver. Now, I hate liver. It's not something for me, but if you want to eat it, I'm not going to stand in your way because it does have very, very many good benefits. You can use carrots, sweet potato, kale, spinach, broccoli, coconut oil, eggs, salmon, tuna, almonds, avocado, sunflower seeds, Brussels sprouts, cabbage, cucumbers and herbs like basil are very, very good as well. And they're going to give you those really good mineral content as well as those vitamins. Now, to help you get those vitamins into the body, you want to look at really empowering your system to do what it needs to do. And it's really important that you've got good vitamin D levels. Now, here in a country like Australia, we have sunshine a lot of the year, and we should be encouraging people to get out in the sun, to get sun exposure without burning themselves so that they're naturally producing vitamin D. However, we're all in this conditioning that being out in the sun gives you skin cancer. Everyone's avoiding sun exposure. It's slip, slop, slap. So putting on sun cream, covering up, wearing a hat and staying out of the sun. Whereas we do need to get the sun to help us produce vitamin D. If you live in the Northern Hemisphere, where during the winter months you're not going to get a lot of sun, I mean, the UK, it's pretty much grey the whole year round, and we get one day of sunshine at 16 degrees and we all strip off and run around getting sunburnt. You can take things like cod liver oil, which is very high in vitamin D, get some mineral formulas, high magnesium, and make sure you're getting everything you need to keep that calcium and phosphorus relationship nice and balanced. So you can brush your teeth with standard toothpaste if you want to, but you can also look for natural toothpaste that have got antimicrobial properties, essential oils, things that are going to be naturally antibacterial and not harm your good bacteria. Of course, you can use oil pulling if you want to. I'm not sure how beneficial it is. Whether you needed to do it for 20 minutes or not is contentious. Maybe 2-3 minutes, and just to get the antibacterial properties from the coconut oil is enough. So using those things is going to be tremendous benefit to your gum health and your overall mouth health. Now, you can use a combination of flossing, little brushes that you use in between your teeth. You can use what's called a water pick, which is like a little jet wash that goes around in between your teeth. I don't really care what you use, just clean in between your teeth as well as brushing. If you don't clean in between your teeth, you're leaving about 40% of your tooth structure dirty, and there's food and stuff stuck in between your teeth and under your gums. If you're enjoying this, I want to say hi to Kathy. She's been watching live, and Felicity and Anissa. Give us a thumbs up, give us some love, say hello, leave some comments. If you're watching the replay, ask questions, leave comments. I always check in and follow back up. I hope you're enjoying this and that it's providing you with some easy tips to manage your oral hygiene, improve your dental health and prevent you from getting cavities. So last but not least, I'm going to give a little self-plug. Consider visiting a holistic dentist and looking at getting your mercury fillings removed. Check for any dental infections or faulty root canal fillings. You can facilitate looking after your health issues, because more toxins in your mouth are going to add toxins into your body. Gum disease is also going to have the same impact. It increases bacterial load and pushes inflammatory products around your body elsewhere. So if we can help you address what's currently going on and then teach you how to stop them from reoccurring and keep everything healthy, you're going to end up with a nice, clean oral cavity, nice mouth, low decay rate, low gum disease rate. You're going to have fresh breath, and you're also going to reduce any issues with your health that might stem from things going on from your mouth. And you might just find that you have this nice, bright, white smile that you want to show off and feel really confident about as well. So thank you very much for joining me today. I'm Dr. Rachel Hall of Evolve Dental Healing, general and holistic dentist in Kenmore, Brisbane. If you would like to know anything more about what we do, then feel free to contact us. And if you'd like an appointment for a consultation and to find out what's going on in your mouth and how we can support you to have better dental health, then please call us on 0737201811, and I'd love to take the time to get to know you and help you reach your dental goals. Thank you very much.